So good morning. We have this wonderful gentleman who came to us some months ago and asked for a request that we quite frequently get. You know, we do a lot of hair transplantation, and of course that's very often on the scalp, but we do also quite a few beard transplantations. And so we have this terrific gentleman who did this procedure, what, about 3 weeks ago?
It was about 2 weeks, 13 days out right now.
Tell us in a nutshell, how was it? We went ahead and filled this beard in very substantially. How was the experience? And
Sure. It was great. I mean, from the moment I reached out to Sistine, everyone was very welcoming and kind and kind of eased any anxieties or questions that I had. Very pain-free. In the procedure, the day of the procedure, there's minor pain. Honestly, didn't even need any of the pain medications
Wow.
in the recovery period. I mean, the only painful moment was a bit of skin irritation and dryness, which subsides with,
Sure.
within a few days. So
that's great.
yeah.
That's great. You know, we do the majority of our hair transplantation, whether it's onto the scalp or the beard or wherever, using follicular unit extraction techniques. You know, years ago we used to do a lot of the strip technique. There are still occasional indications to do that, but the great majority are follicular unit extraction, FUE, that you may have heard about or researched on the internet. And truly, I'm always telling patients that hair transplantation, whether it's the beard or the scalp or what have you, is probably the most improved cosmetic procedure of the last 25 years, 20 years. Because we don't use those plugs anymore. We go with these individual follicular units, and then the way we harvest it now, there is no further incision, big long incision on the back. So this procedure, recovery-wise, really within a day or two, most people are like, there's nothing to talk about. So that's great. And what you're seeing now, you're seeing some of the hairs. Now, of course, it's very early, and as perhaps you've researched out there in internet land, the hairs sort of fall out over the period of the first 2, 3, 4 months, and then they start to grow. So we're very early in the stage, but what you can see now is that there's really not much in the way of inflammation. From the back, it looks perfectly normal, it's undetectable. And so, you can walk around town, go to the coffee store, have dinner, and nobody's the wiser.
Yeah.
And so that's great. The recovery is easy, and I think the results are really fantastic with all of these. And our beard transplantations are just working out fantastic. So, if you have anything else to say.
Just that I'm really happy with the whole result and the team, and I would definitely recommend it. 10 out of 10.
Okay, great. Thank you so much. All right, well, we'll give a few further updates down the line, but thanks for your attention.